Hi, I'm Anise Bowman, and in the upcoming fall, I will be a junior at the Cleveland School of Science and Medicine. This summer, I worked in my public health internship in regional urology on my project entitled The Likelihood of Complications After Cryotherapy in Prostate Cancer Patients with Specific Demographics. Background. The treatment options for prostate cancer include radiation therapy, which is the process of radiating a specific part of the body, a prostatectomy, which is where you remove part or the entire prostate, hormone therapy, chemotherapy is where you give a cocktail of different drugs to treat the cancer, active surveillance, and cryotherapy, which is where you freeze the prostate to kill the cancer cells. Cryotherapy, the steps to cryotherapy are 1. Insert the probes into the mapped out areas of the prostate. The prostate is mapped out by inserting ultrasound into the rectum. And 2, you release argon gas through the probes, and argon gas freezes to about 187 degrees below Celsius. And 3, you release helium gas through the probes, which thaws to about 44 degrees Celsius. And 4, you repeat steps 2 and 3 to ensure the death of the cancer cells. Cells are killed by cryotherapy in 3 ways. First, the blood circulation is cut off. 2, the cells are poisoned by potassium and sodium. 3, the cells burst due to the expansion. The main benefit of cryotherapy is that after 1 year of having the procedure, if you don't experience any complications, then you will most likely never experience those complications. Some complications include urinary frequency, erectile dysfunction, urethral sloughing, and swelling. Hypothesis. African American men will have more complications due to less health care opportunities, low health care affordability, and other health care outcomes. Caucasian men will have less complications because they're known to see physicians more regularly. Repeat and salvage cryotherapy patients will have more complications than primary cryotherapy patients because in a repeat cryotherapy, your chances are doubled of having a complication. And in salvage cryotherapy, you have high complication rate because damaged tissue, you already have damaged tissue prior to radiation. Younger patients will have less complications because, in theory, the younger you are, the stronger your body is. And inversely, older patients should have more complications because their bodies are more feeble. Gleason score is a score given to the cancer to show how aggressive the cancer is. The lower the Gleason score, the less aggressive it is. Low-grade cancers will have less complications because they're less aggressively treated. High-grade cancers will have more complications because they are aggressively treated. Methodology. Demographic categorization. Prostate cancer patients came in for treatment options. I took the patients who chose cryotherapy. I collected the patient's info with specific demographics. The race of African American or Caucasian. The type of cryo being repeat, primary, or salvage. Salvage being having prior radiation. And I took patients due to their age, which is 50 to 59, 60 to 69, 70 to 79, and 80 to 89, and their Gleason score, 6, 7, 8, and 9. I went through each patient's chart and collected the information from their physician consultation from 6 months to a year after the cryotherapy. I noted the complications that were present at that time. I also categorize the complications into broader groups. I have urinary incontinence, which is not being able to control urination, voiding dysfunctions, which are problems while urinating and how often urination occurs, urinary tract infection, hematuria, which is blood in the urine, sexual complications, and urethral sloughing, where the skin of the urethra falls off the wall and causes a blockage in the urethra. I categorize the complications more into perineal pain, which is pain of any type in the perineum section, swelling, and an abnormal DRE, which is the picture that can be shown to your right, which would be you would feel in the rectum to see if there's an abnormality in the prostate. I compared the percentages of the specific complications present within demographic subgroups. Results. As you can see, African Americans had a higher complication rate in 4 of the 9 areas. But you should also note that Caucasian men experience drastically more sexual complications. In general, repeat and salvage cryotherapy patients experience more complications, which completely supports my hypothesis. Inverse to my hypothesis, younger patients experience more complications than older patients. In most areas, the complication rates were nearly the same for all the Gleason scores. And this graph displays the demographics of each race. This shows that there were not any outlining variables that could affect the results of my experiment. Conclusion. Race of African American men in some areas have more complications, and Caucasian men experience higher sexual complications. We are not sure why this occurred, and it is suggested for further research. For type of cryotherapy, repeat and salvage cryotherapy did experience more complications than primary. Within age, 50 to 59-year-old males experience more complications than all the other age groups. This could be because they're not used to the complications that are occurring, or they're more outspoken about the complications. 80 to 89-year-olds experience less complications. This could be because they're not verbal about the complications that they are experiencing. In the Gleason score, we found that they all have pretty much the same rate, except in sexual complications. And we know that's because the nerves that arouse the penis are in close proximity to the prostate. Recommendations. I recommend that we inform patients who have had prior treatment that they are more at risk of experiencing these complications, and also inform younger patients thoroughly of the complications that will most likely occur. Stress the importance of taking medication to younger patients. And physicians can treat more aggressively if patients are okay with sexual complications. And to do a repeat study with a sample size to increase confidence in my conclusion. I'd like to thank Dr. Stephen Jones, my mentor, Dr. Ahmed El-Shafi, Ms. Tracy Krebs, Ms. Nedra Starling, and last but not least, Ms. Rosalind Strickland.